Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing about the anatomy of parotid gland. And in another separate video, I'll also discuss about the anatomy of submandibular and sublingual glands. You can also now purchase my notes. I have added links in the description. Okay, so before we discuss the parotid gland, first we need to know that salivary glands can be major or minor salivary glands. We already know that there are three paired major salivary glands, which is the parotid, the submandibular, and the sublingual glands. Now, the minor salivary glands are these very numerous tiny glands, which is all over in our oral cavity. It is scattered in the lips, cheeks, palate, tongue, etc. And each of them, they have very short ducts which open up into the oral cavity. So that's the classification of salivary glands. Now let's start talking about the anatomy of the parotid gland. Now, as we know, parotid gland is the largest of all the three glands that we have over here. It is wedge-shaped and it usually weighs about 20 to 25 grams. And if we had to talk about what type of gland is this basically has more of serous acini and very, very few mucous acini. So it is predominantly a serous type of gland. Another interesting thing to know that is sometimes we also have something which is known as the accessory parotid gland. What is that? That is a separate part of this gland which usually lies on the masseter muscle between the parotid duct below and the zygomatic arch above. I'll show you more images of this in a little while. So parotid gland, it lies in an area which is known as the parotid bed. Now we need to know what is this area, what are the boundaries of this area. So this the parotid bed, it is bounded anteriorly by the posterior border of the ramus of mandible. If you see in the image over here, this is the ramus of mandible, the posterior border of the ramus of mandible and the medial pterygoid which is attached to the ramus. So that is the anterior boundary. So we have seen this is the anterior boundary. Then posteriorly, it is bounded by the mastoid process and the sternomastoid muscle. This is our mastoid process and this is our sternomastoid muscle. This is forming the posterior boundary of the parotid bed. Superiorly, it has the external auditory canal and the posterior part of the temporomandibular joint. So this here is our external auditory canal and this here is our temporomandibular joint. So this forms our superior boundary. Inferiorly, there is posterior valley of digastric and the stylohyoid muscle. So if you see in the image, this over here is the posterior valley of digastric and around it would be the stylohyoid muscle. Medially, it has the styloid process and all the attached muscles to it. So these are the boundaries of the parotid bed, basically the region where the parotid gland lies. But the parotid gland itself does not have the same extent as that of the parotid bed. So now let's look into what is the extent of parotid gland. Now superiorly we have the zygomatic arch. Inferiorly we have the upper part of the neck where it overlies the posterior belly of digastric and the anterior border of the sternocleidomastoid. So this is the sternocleidomastoid. This is the anterior border of sternocleidomastoid. This is it overlies right over here in the upper part of the neck. Anteriorly lies the masseter muscle. Posteriorly, it extends below the external auditory canal. So this is our external auditory canal. It extends below it and onto the mastoid process overlying the lateral process of C1. And medially, it fills a gap between the mandible anteriorly and the mastoid and styloid process posteriorly. So this is about the extent of the parotid gland itself. You can see this is here is the parotid gland. It is irregular and wedge-shaped. And the extent of parotid gland is very different from that of the parotid bed. Now, parotid gland has two capsules. So there is an inner true capsule and an outer false capsule. Now, the inner true capsule is the part which is formed by condensation of the fibrous stroma of the gland. Whereas this outer false capsule, which is also known as the parotid sheet, it is formed by the splitting of the investing layer of the deep cervical fascia. Now let's look at the image over here. This right here is our investing layer of the deep cervical fascia. You can see how it splits over here and it encloses the gland completely. Now as it splits over here, it divides into a superficial lamella and a deep lamella. So this first superficial lamella is usually stronger than the deep lamella. And this superficial lamella gets attached to the zygomatic arch over here, and it blends with the epimysium of the masseter, which lies right over here, to form the parotidomasseteric fascia. This is a very thick fascia. Next is the deep lamella. So deep lamella is this one. Deep lamella is usually thinner compared to the superficial one, and that goes and attaches to the tympanic plate and the styloid process of the temporal bone. So you see, this is the tympanic plate, this is the styloid process, that's where it gets attached. And in the process, it also gets thickened in a part. You can see in the image, this part, it has gotten thickened to form the stylomandibular ligament. Now, this stylomandibular ligament gets its attachment from the tip of the styloid process to the angle of the mandible, and this ligament is responsible for separating the parotid from the submandibular gland. So you can see we have an inner true capsule and an outer false capsule, which is known as a parotid sheath. A parotid sheath is formed by the investing layer of deep cervical fascia. It splits into two parts. The superficial part, lamella, it goes and attaches to zygomatic arch, and somewhere along it forms the parotidomasseteric fascia. The deep lamella gets attached to the tympanic plate and the styloid process, and it also gets thickened to form the stylomandibular ligament. So this is about the capsule. Now, what is the importance of knowing all of this? Why do we even need to know? What is the surgical or the clinical significance of knowing this? Now, we have found out that parotid fascia, parotid sheath, and these are all actually very tightly adherent. So, whenever there is a parotid swelling, say there is an infection of the parotid, for example, the most common one is mumps. Parotid swellings can end up being extremely painful because of the presence of this unyielding parotid capsule. So, any inflammation or pressure that develops inside the parotid gland, it will end up in causing acute pain in the patient. Why? Why do you feel pain? Because the capsule is very unyielding. So, whenever there is a stretching of the capsule happening, it also ends up stimulating the branches of great auricular nerve which lies over it. So pain, this pain that you feel, it will get exacerbated during the time of meals, because when you have meals, there is a gustatory stimulation of the parotid gland happening. So there is increased parotid secretion happening at that time. So as there is increased parotid secretion, that also increases the pressure which is forming inside of the capsule. That is why you feel more pain in case of parotid swellings. You feel more pain during the time of meal, and the pain is relieved somewhat, not completely, but relieved somewhat after the meal is over when the parotid secretions have decreased. So this is the importance of knowing about the capsule of parotid gland. This is the clinical significance. Now let's move on to discussing the lobes of parotid gland. Now, parotid gland is, each of them is divided into two lobes by three structures which pass through it. What are these three structures? If you look in the image over here, we have the facial nerve, the retromandibular vein, and the external carotid artery. So there's a nerve, vein, as well as artery. These three structures, they pass through the parotid gland. And this plane that they are passing through is known as the fasciovenous plane of Patty. Now, the importance of this is as they pass through the structure of the parotid gland, it ends up dividing the gland into superficial lobe and deep lobe. You can see in the image that the superficial lobe is the majority of the gland, takes about 80% of the gland, and the deep lobe is about 20% of the gland. Now, the superficial lobe, if you see in the second image over here, this is the superficial lobe. The superficial lobe, it extends through the anterior and inferior to the external auditory canal, and then it extends down to the angle of the mandible. So you can see that this is the mandible. The gland extends like this in this direction. Whereas the deep lobe, this is the deep lobe. This deep lobe, it extends through the stylomandibular tunnel formed anteriorly by the ramus of the mandible and posteriorly by the stylomandibular ligament. So these are the two lobes of the parotid gland, which is formed by the passing of three structures. Very important to remember these three structures are the facial nerve, the retromandibular vein, and the external carotid artery. And the plane that is formed by these three structures is known as the fasciovenous plane of Patty. Now, what is the clinical significance of knowing this? So, any mass which forms inside the parotid gland, we need to define its location as superficial or deep to help us in planning the surgical approach that we need to take in order to limit any damage to the facial nerve. So there are a lot of pointers that you need to know how to locate the facial nerve when you're performing parotidectomy. That's a separate video I already have made. You can check that out. So it is important that we know, does the mass involve the superficial lobe only or does it also involve the deep lobe? Accordingly, we'll define how much of the parotidectomy needs to be done. So this is about the lobes of parotid gland. Now let's move on to discussing what are the different parts of parotid gland. Each of the gland, if you see in the image over here, we have an apex right over here. Then we have the base. Then we have three surfaces and three borders. If you look at the surfaces, we have the superficial surface, the anteromedial surface, and the posteromedial surface. And there are three borders, the anterior, posterior, and the medial borders. Now we'll discuss each one of them, and it's important to know what are the relations of different structures at each of these parts. So let's get started with the apex. Now, if you see right over here, we can see that the apex is directed below and it ends up overlying the posterior belly of digastric and it appears in the carotid triangle. Important things to remember here that there are two structures which pass through the apex. See in the image right over here, we can see that there is a cervical branch of the facial nerve and the anterior and posterior divisions of the retromandibular vein which passes through the apex of the parotid gland. So there are two structures that passes over here. Next is the base. If you see in the image, this is the base. You can see how it is concave in shape and this is related to the external auditory canal. This right here is external auditory canal and the posterior part of the temporomandibular joint. Again, there are two structures you need to remember that passes through the base and these are, first of all, there is a superficial temporal vessels and second, there is an auriculotemporal nerve. These are the two structures which are passing through the base of the parotid gland. Now let's discuss the surfaces. So there are three surfaces. We have the superficial surface. If you see in this image right here, there are three borders and three surfaces. So here is the superficial surface. Then the anterior border separates it from the anteromedial surface. The medial border separates the anteromedial from the posteromedial surface, and the posterior border separates the posteromedial from the superficial surface. So now we'll discuss the relation of each of these three surfaces and three borders. So starting with superficial surface, going superficial to deep, what are the structures that you will be seeing? So if you see in the left side image over here, it is covered from superficial to deep. The first layer is skin. Second layer is superficial fascia. Now, this superficial fascia contains anterior branches of the great auricular nerve and superficial parotid lymph nodes and as well as the platysma muscle. Third is the parotid fascia. So, all of these structures together are the relations on the superficial surface of the parotid gland. You can see a little while before I discussed why because of the tight capsule, you feel pain when there is an infection or parotid swelling happening. That's because of the nerve that lies on top of it, and the nerve here is the great auricular nerve. Because the great auricular nerve gets stretched, that's why you feel more pain when there is an increase in secretion happening in the parotid and the parotid gland enlarges. Okay, so that's about the superficial surface. Now let's discuss the anteromedial surface. So this anteromedial surface is actually very deeply grooved for the ramus of the mandible. And what are the relations that we'll see over here? Let's look at the image over here. So this right here is the anteromedial surface. Here is the superficial surface you can see, and this is the posteromedial surface. So in the anteromedial surface, you can see we have the masseter muscle. Then we have the ramus of the mandible, especially the posterior border of the ramus of the mandible and the capsule of the temporomandibular joint. Then we have the medial pterygoid muscle. And the groove that is forming because of the ramus of the mandible, the outer lip of the groove transmits the facial nerve. This over here, you can see that this is a facial nerve passing, and the inner lip of the groove, it transmits the maxillary artery. So these all five are the relations of the anteromedial surface of the parotid gland. Next, let's talk about the posteromedial surface. Again, I just showed that this is our posteromedial surface. So let's look at the image over here and see what are the structures related here. First, we have the mastoid process. And along with the mastoid process, we have two muscles, the sternomastoid muscle and the posterior belly of digastric. So these three structures are the first relation that is forming here. Second, we have the styloid process along with all the muscles which are attached to it, which is the styloglossus, stylopharyngeus, and stylohyoid muscles. And deep to this styloid process, we have right over here, see in the image, this is the internal carotid artery, the internal jugular vein, and the last four cranial nerves. So this is the next structure, next couple of structures which is related. Other than this, we also have the facial nerve, which is not seen in the image over here. After the facial nerve emerges from the stylomastoid foramen, it enters the gland in this surface. Last of all, the external carotid artery, it lodges in a groove in its lower part before the artery pierces the gland to enter it. So these are all the relations of the posteromedial surface. Starting with, first we have the mastoid process along with the two muscles, posterior belly of gygastric and sternomastoid. Then we have the styloid process with the muscles attached to it. Deep to the styloid process, we have the basically the carotid sheath structures, the the internal carotid artery, then internal jugular vein, and the last four cranial nerves, and then we have the facial nerve. So these are the relations of all the surfaces of the parotid gland. If you now next move on to discuss what are the structures which is passing through the different borders. So we have three borders over here. First is the anterior border. Now, if I showed you in the image before that the anterior border separates the superficial surface from the anteromedial surface. Now, again, a very important question here is to remember what are the structures which are passing deep to this anterior border. Now, if we go above downwards, let's look at the image over here. The first structure passing is the temporal branch of the facial nerve. Then we have the transverse facial vessels, which is artery as well as vein. Next, we have the zygomatic branch of facial nerve. Next is the upper buccal branch of the facial nerve. Next is if we have an accessory parotid gland and duct, that is what passes over here. So this is where we see the accessory parotid gland. Next, we have the parotid duct. The other name of parotid duct is also Stenson's duct. And what is submandibular duct called? It is known as Wharton's duct. Okay, next structure is the lower buccal branch of facial nerve. Next is marginal mandibular branch of facial nerve. So these are all the structures that are passing underneath the anterior border of the parotid gland. It is a long list, and you need to remember in the order of above downwards. What are the structures in order passing deep to this border? So these next, after this, we'll discuss the next border, which is the posterior border. Now, posterior border is much simpler and it has less amount of structures passing. So this posterior border, first of all, divides the superficial surface from the posteromedial surface, and it rests on the sternocleidomastoid muscle. And there are two structures which are passing deep over here, and they are the posterior auricular nerve and the posterior auricular vessels. These are the only structures which are passing deep to the posterior border of the parotid gland. Lastly is the medial border. You cannot obviously see it in this image. The medial border is dividing the anteromedial surface from the posteromedial surface, and this is related to the lateral wall of the pharynx. So sometimes you'll see that in a case of swelling or an abscess formation in the lateral wall of the pharynx, like a parapharyngeal abscess, for example, you can end up having a parotid swelling as well. So these are all the relations of the different parts of the parotid gland, and it is very, very important to remember these relations because there are multiple structures passing underneath the borders, and these are very common viva questions you get in your grand viva in your practical exams. Next part is we'll discuss what are the different processes of the gland. Now, what do you mean by processes? Now, we have seen that parotid gland is actually a very irregular lobulated mass and it ends up sending different processes in various directions. So, our image right over here, you can see there are multiple processes we can see. First of all is the facial process. Right here is the facial process. The facial process is this triangular projection which extends forward. As you can see, it is extending forward superficial to the masseter muscle along with the parotid duct. This is our facial process. Along with that, there is an accessory process which is also known as the accessory parotid gland. So, accessory parotid gland is a small part of this facial process which gets detached from the main gland and hence it comes to be known as the accessory parotid gland. And this is located between the zygomatic arch and the parotid duct. You can see this is the zygomatic arch over here and this is the parotid duct. So this area right over here is the accessory parotid gland. Next is the pterygoid process. This right here is our pterygoid process. This pterygoid process is also a triangular projection which extends forward from the deep part of the gland between the ramus of the mandible and the medial pterygoid muscle. So that's about a pterygoid process. Next is our glenoid process. This lies superiorly. So this process passes upwards in between the external auditory canal and the temporomandibular joint capsule. You can see this is our external auditory canal and this is a temporomandibular joint capsule. The process passing superiorly in between these two structures is the glenoid process. Next, we have the carotid process. You can see this here is the carotid process. Now, this lies posterior to the external carotid artery. You can see in the image, this red structure over here is the external carotid artery. The process which lies posterior to it is known as the carotid process. There's another process which is not seen in the image here, and it is the pre and the post styloid process. So, we know that the styloid process lodges in a groove. The gland which lies in front of the groove is the pre-styloid process, and the pre-styloid process is related to internal carotid artery, and the part which is behind the groove is the post-styloid process, and this is related to the internal jugular vein. So these are all the 6 processes of the parotid gland that you need to know about. An accessory parotid gland also is one of these processes. Next, let's talk about a very important part, which is the 3 structures which are passing through our parotid gland. Now, previously, when I was telling you about the 2 lobes formed of the parotid gland, we talked about 3 structures which were passing from superficial to deep. These were a nerve, vein, and an artery. Nerve, vein, artery. So, the nerve is facial nerve, then there is retromandibular vein, and then there is external carotid artery. So if you see in our right side image over here, from superficial to deep, first we have the nerve, then we have the retromandibular vein, and then we have the external carotid artery. So these are the 3 structures which form the faciovenous plane of Patty. Now let's discuss a little about how the structure passes and what happens as the structure passes through the parotid gland. So the first one is facial nerve. So this is the most superficial structure that we have over here. So the facial nerve, after it emerges from the stylomastoid foramen, about 2.5 centimeter deep to the middle of the anterior border of the mastoid process, it starts passing downwards and forwards for about 1 centimeter. And then it pierces the posteromedial surface of the parotid gland. If you see in the first image here, we can see this is our mastoid process. The stylomastoid foramen will be somewhere here. And then as it exits, you can see here it is entering from the posteromedial surface. So this is how the facial nerve enters the gland. It enters through the posteromedial surface of the parotid gland. Now, once it has entered the parotid gland, within the gland, this nerve runs for 1 centimeter superficial to the vein and artery. And then at one point, it divides into temporofacial and cervicofacial trunks. Now, let's look at the third image over here. we can see it has divided into two trunks. And the temporofacial trunk now runs upwards. You can see here the temporofacial trunk will run upward, and it divides into two branches, the temporal branch and the zygomatic branch. Whereas the cervicofacial trunk runs downwards. And after passing downward and forward, it divides into three branches. It will form the buccal branch, the marginal mandibular branch, and the cervical branch. So you see this image that you're seeing over here, this goose, it all the five branches going from above below, all these five terminal branches of the facial nerve, they look like as if they are a goose's feet. So because they look like goose's feet, and they are actually leaving the gland through the anterior border of the gland. So the facial nerve enters through the posteromedial surface, and it exits through the anterior border of the gland. And this branching pattern that looks like a goose's feet is known as pes anserinus. And this is a very important question you'll definitely be asked in your viva and even in your theory exams. What is pes anserinus? So the pes anserinus is the pattern that is formed by the five terminal branches of the facial nerve as it exits the parotid gland at the anterior border. So this is the course of facial nerve through the parotid gland. Next, let's talk about, before we go into that, one more thing. What is the clinical significance of knowing this pattern, or knowing how the facial nerve divides inside and how the branches passes? There must be some importance of it. Why do we need to know about it? So whenever a parotid abscess develops, we usually drain the parotid abscess by giving very small horizontal incision. This is known as the Hilton's method. Why do we give particularly horizontal incision, and why do we not give a vertical incision? Now, if you look at the image right here, you can see how all the nerve that are passing, they are all passing in a very horizontal manner. So if we give a vertical incision, you'll actually end up injuring the facial nerve. That is why you'll definitely need to remember, in a case of parotid abscess, we drain the abscess by giving horizontal incisions so as to not damage the facial nerve at all. That is the clinical significance of knowing this. Next structure is the retromandibular vein. Now, the retromandibular vein is the middle structure lying in between the facial nerve and the external carotid artery. Now, let's look at the image on the right side. This retromandibular vein, this is the retromandibular vein. Now, the retromandibular vein is formed by the union of two veins. And these veins are the superficial temporal vein and the maxillary vein. So, you can see here is when it forms the retromandibular vein. After the retromandibular vein is formed, it passes through the parotid gland, and then it divides into two parts, into an anterior division and a posterior division. So you see, this is the anterior division. This anterior division then combines, or rather joins, with the facial vein, and then it forms the common facial vein. Whereas the posterior division, this is the posterior division of the retromandibular vein, that joins with the posterior auricular vein, and then it forms the external jugular vein. So this is how the retromandibular vein passes through the parotid gland. It is formed by two different veins, superficial temporal and maxillary joining, and then as it passes through the gland, it divides into anterior and posterior divisions, and these exit the parotid gland and then forms different veins by union with other veins. That's about the retromandibular vein. Last structure is the external carotid artery, which is the deepmost structure over here in this plane. So the external carotid artery, as it ascends, it divides into two terminal branches, the superficial temporal and the maxillary artery. Other than this, we also have a transverse facial artery, which is a branch of the superficial temporal artery. Sometimes we saw in one of the relations in the border, when we were studying the anterior border of the gland, we saw that, let's look at it. This is our anterior border of the gland. We saw that transverse facial artery passes through the anterior border of the gland. So that is also a part of this external carotid arteries coming from one of the branches. Sometimes we see posterior auricular artery arising from within the gland from the external carotid artery. So this is about the three different structures that are passing through the parotid gland and how what is the course that it takes within the parotid gland. Next, we come on to discuss what is parotid ducts. Let us know how the parotid ducts has its course. There is a very peculiar course that the parotid duct takes, and it passes through. There's a lot of structures that it pierces. That is also an important question that we need to know. So parotid duct is also known as Tenson's duct, whereas submandibular duct is known as a Wharton's duct. This is 5 centimeter in length and 0.6 millimeter of internal caliber. Now let's discuss what is the course of this parotid duct. We'll see in the image, in this second image over here. So parotid duct is formed by the union within the gland of two vertical ducts. So two vertical ducts combine within the gland to form the parotid duct. Now, if we look at the image over here, this is the parotid gland. The parotid duct emerges at the anterior border. We saw in an image before also how the parotid duct is one of the structures which is related to the anterior border of the gland. So as it exits from the anterior border of the gland, it passes forward on the masseter muscle. This is our masseter muscle. So it passes forward on the masseter muscle between the upper and lower buccal nerves. Now, at the anterior border, this is the anterior border of the masseter muscle, it abruptly turns medially. Now, this is the first bend that the parotid duct takes. We have 3 total bends that we'll be seeing over here. So, this is where the parotid duct bends first. And after bending here, abruptly turning medially, it passes through a buccal pad of fat. So, this is the first structure that gets pierced by the parotid duct. After piercing the buccal pad of fat, next it pierces the buccopharyngeal fascia and then it pierces the buccinator muscle. Now, after piercing the buccinator muscle, it takes its second bend. See over here, this is the second bend. It takes a bend over here and it runs forward for about 1 centimeter in between the buccal mucosa and the buccinator muscle. So, this part is 1 centimeter. It runs for about 1 centimeter and then it decides to turn medially, taking the third bend. So, this over here is our third bend that is happening. Our first bend happens here, then is our second bend, and this is our third bend that is happening over here. And as it turns medially, it pierces through the in and open into the vestibule of the mouth on a papilla which lies opposite to the crown of the upper second molar tooth. Our image, the first image over here, you can see this is the second upper molar tooth. Sorry. This is our second upper molar tooth. It opens into the vestibule of the mouth just opposite to the crown of the upper second molar tooth. And this image over here, you can see this is a parotid duct opening. So this is the course of the parotid duct. The important things to remember here is the whole course because it takes 3 total bends over here which you need to know about. And there's another important question that is asked, that is, what are the structures pierced by the parotid duct? So the structures are, number 1 is buccal pad of fat, number 2 buccopharyngeal fascia, number 3 buccinator muscle, and number 4 is the buccal mucous membrane. So this is the course of the parotid duct. Second question is, from an anatomy perspective, what is the surface marking of the parotid duct? So the parotid duct is represented by a line, if you draw from the lower border of the tragus to midpoint between ala of nose and red margin of the upper lip, middle third of the line will denote the surface marking of the parotid duct. Now we have discussed about the course of the parotid duct and what happens, etc. What is the clinical significance of knowing all of these different facts? So the first importance is we have seen that the duct takes a very tortuous course. This tortuous course gives a very valve-like mechanism to the duct. And because of this valve-like mechanism, it prevents the inflation of the duct system of the parotid gland during excessive blowing of the mouth. For example, in trumpet blowers, they blow through their mouths. That's a lot of excessive blowing happening. Because of this valve-like mechanism, the inflation of the duct is actually prevented. So that is one important feature. Second is this parotid duct is actually a very superficial structure on the face. So, in injuries to the face, it is very easily cut accidentally, even during surgeries of the face. So, parotid duct is actually a very superficial structure, and but it is more prone to damage in cases of injuries or any surgeries on the face. Thirdly, sometimes a calculi or a stone may form in the parotid gland and the parotid duct. Now, this calculi lodged in the distal portion of the gland could be taken out by splitting the duct from its opening right in the mouth. We saw that how the duct opens in the opposite the crown of the upper second molar tooth. So it is possible that you can take out the calculi in this distal portion by splitting the duct right over here. So that's all about the parotid duct. Next, let's talk about the different blood supply, nerve supply, and lymphatic drainage of parotid gland. Starting with blood supply, we divided into arterial supply and venous drainage. The arterial supply is by branches of the external carotid artery. Venous drainage is via the retromandibular vein into the external and internal jugular veins. Lymphatic drainage, it happens through the superficial and the deep groups of parotid lymph nodes, and efferents from these nodes ultimately terminate in the jugulodigastric group of deep cervical nodes. That's about our lymphatic drainage. Now let's talk about a nerve supply. So we have three types of nerve fibers over here. We have parasympathetic fibers, sympathetic fibers, and sensory fibers. Now, parasympathetic and sympathetic, they're both responsible for giving a secretomotor supply to the parotid gland. When the parasympathetic fibers are stimulated, it gives a very watery secretion from parotid gland, whereas when the sympathetic fibers are stimulated, it gives mucus-rich, sticky secretions. So we can see how the different nervous system, the different nerve fibers getting stimulated will give different kinds of secretion from the parotid gland. Now let's talk about the pathway of these. So first is our parasympathetic fibers. So in case of parasympathetic fibers, the preganglionic fibers, they arise from the inferior salivatory nucleus of the medulla. Then this passes through the glossopharyngeal nerve. Next goes through the tympanic branch of the glossopharyngeal nerve, also known as the Jacobson's nerve, which goes to join the tympanic plexus. And from the tympanic plexus, it passes on to the lesser petrosal nerve. Now, this goes and relays in the otic ganglion. So, this is our ganglion here. So, the first part that we just discussed here, this whole pathway is the preganglionic fibers. Now, after relaying at the otic ganglion, the postganglionic fibers pass through the auriculotemporal nerve and then ultimately supplies the parotid gland. So this is our pathway for parasympathetic secretomotor supply. Next is sympathetic fibers. These sympathetic fibers come from the sympathetic plexus, which forms around the external carotid artery. And this is created by the postganglionic fibers coming from the superior cervical ganglion. So this is the origin of our sympathetic fibers. Third is our sensory fibers, and these sensory fibers come from two nerves. First is the auriculotemporal nerve, and second is greater auricular nerve coming from C2 and C3. This is about our nerve supply to the parotid gland. And what is the importance of this nerve supply? The clinical significance of knowing this nerve supply is a condition which is known as Fraze syndrome. Now, what is Fraze syndrome? Sometimes what happens is there can be a penetrating wound to the parotid. This penetrating wound can end up damaging the auriculotemporal nerve and the great auricular nerve. We have already spoken previously how these nerves are related to the different areas in the parotid gland. So now, after these nerves get damaged during the process of healing, we saw that auriculotemporal nerve has the postganglionic fibers, whereas sensory fibers are from the great auricular nerve. So during the process of healing, the secretomotor fibers of auriculotemporal nerve, they grow out and they end up joining with the distal end of the great auricular nerve. Now through which these fibers end up reaching the sweat glands in the facial skin. Therefore, what we see here is in these cases, when a patient starts eating, we see that they are complaining of having beads of sweat appearing on the skin over the parotid because the stimulus that was intended for the auriculotemporal nerve to cause a secretion of the parotid gland is now going towards the sweat glands instead. So you're ending up having beads of sweat happening in the skin over the parotid, which is the supply of the great auricular nerve, when the patient starts eating. This particular syndrome is known as the Fraze syndrome. So, this is the clinical significance of knowing the nerve supply and the pathway of the nerve supply. So, that completes our topic today. If you have any further questions on parotid gland anatomy, you can note them down in the comment section and I'll get back to you. Thank you.